Well, good afternoon, everyone. My name is Chris Power. I'm the President and CEO of Capital Health, and I'll give a short statement in a moment, and then we'll be open to take questions. So I have with me a few folks from our team, Dr. David Kirkpatrick, who is our Chief of Surgery, Dr. David Anderson, who is our Chief of Medicine, and Barbara Hall, who is our Vice President, Person-Centered Health. Well, this has been a difficult and disappointing day for our organization and, most importantly, for our patients. This concerning illegal strike by some registered nurses in Local 97, along with others in our workforce, without notice or a satisfactory emergency staffing level, undermines the shared responsibility of our care providers and Capital Health to offer safe and high-quality services to Nova Scotians. We have many more patients currently in the QE2 than we can safely care for without the staff who have walked out. We've been forced to close our inpatient addictions or our detox unit today because we've had no registered nurse coverage. Those patients are being discharged where appropriate or transferred to other districts. We have had to postpone almost 70 surgeries scheduled for the QE2 today, on top of the 19 that we had already canceled or postponed because of our scaling down in anticipation of a strike on Thursday. We are extremely grateful to those members of Local 97 who have decided to respect the law and their patients by remaining on the job today, and we urge others to return to their roles immediately. This illegal action is causing potential risk to our patients in this district and throughout the province. I'll now open the floor to any questions that anyone has of us and ask my colleagues to join me. Well, we know from about 30% of our nurses have not, and that is in our inpatient areas. So our ambulatory areas, we're still assessing that. And people seem to be coming and going, but relieving some of our staff. But it looks to us to be about 30% of our staff have not come to work today. Yeah. Our nurses. Dave, would you like to, Dr. Kirkpatrick?
Well, of course, we've prioritized those cases. So what we've done is we've met at least twice a day. We've been meeting as an OR committee. We take a look at the case mix that was lined up for today, and what we did is we decided to do the ones that required the surgery most urgently. So we had some cancer patients in there, some heart surgery patients, a number of patients where the surgery was time sensitive in that, for example, a patient had some chemotherapy and there's a window of about 7 days afterwards that you need to do the surgery in order to have the two work well together, and so that was very important that the patient have their surgery today. So in another circumstance, it might have been able to postpone that, but so we were able to do most of the cases that were time sensitive, but there were still more than half the surgeries booked for today were canceled. Well, we do, I don't know what the total list was today, but on average we would do about 120 a day here.
Were transplants able to be done today?
There weren't any transplants on the list today, just by chance.
And if they had been,
they probably would have gone ahead.
If a patient is at home with scheduled surgery and they're not sure whether their surgery will go ahead, what kind of determining factors determine whether their surgery will go ahead or not?
First of all, the surgeon's office will be in contact with them directly as to whether they would. Now today, because we weren't sure exactly how many nurses would show up for work, all of the patients who were canceled did actually show up at the institution for the surgery and then were sent home later.
What were some of the reactions?
Actually, they were fairly understanding for the most part.
Are there any patients in danger right now?
At the moment, I don't think so. I think most of the ones that were, there are many patients where you'd like to get the surgery done if it's cancer, for example, in the next week or so. So 1 or 2 days won't make any difference. But if this went on for a long period of time, then we'd be very concerned.
You said that there were patients, there were too many patients at the QE2 or something that you can handle? I didn't quite understand that.
So we're full here at the QE2, and we have an emergency department with patients in it that need to be admitted. And in some of our units, we have full staffing, like our intensive care units, our dialysis unit, et cetera. But on some of our other units, we don't have the nursing staff that we would normally have, obviously, if 30% aren't here. So we have a number of patients in our hospital that we don't have the right mix of staffing for to care for. Now, always when these kinds of things happen, or we have emergency situations, people rally, and we have a number of management staff and others who are lending a hand for today. Could we continue this kind of care for any length of time? The answer would be no. We'll continue to try to move patients out to other districts. The weather has not cooperated with us so much today, but where we can, we'll send patients home, and that's always been part of our planning. So we can reduce our number of surgical procedures other than those emergency procedures, but where we have people coming in for medical kinds of treatment or admitted to hospital, that's where we get into trouble, and there are no other options for many of these people but to be in hospital.
How many could you withstand tomorrow? Will you be able to cope with a strike if they continue to stay up tomorrow?
Well, we will have to cope with whatever comes our way because we have people who are dependent on our care. It will become increasingly problematic, and more patients will be at risk the longer this goes on.
And what happens to the nurses that are out? Are they fined? Are they arrested? I mean, that's what they were saying, you threatened to arrest them and you intimidating them. What happens to the nurses that went out?
So I don't believe we're intimidating anybody. What we were just doing is indicating to people what the repercussions could be if they took illegal strike action. Our focus today is on our patients and patient safety. We've had a number of staff who just didn't come to work, people who came and left, and we'll be looking at that with our human resources people over the next few days to see what will happen for those particular staff who've taken illegal action. But our main focus is on our patients.
Could they be fined, and what happens to them? I know you're not concentrating on that today, but what could you do?
There are a number of different avenues that we could take. Certainly, if you're not here to work, you wouldn't get paid for not working. If you abandoned your patients and didn't show up, we can go through the College of Registered Nurses. There are a lot of different ways that we can come at this, and we'll be thinking about that as we go forward. But currently, our focus is on our patients.
But there is a finite window here, correct? I mean, once the legislation is passed, so you're looking at about maybe Friday at the latest, perhaps Monday. So that message is important to the public too, right? You're not into an indefinite situation here.
That's true. So once the legislation is passed, then the union will no longer be in a legal strike position until essential services has been determined. So yes, we're not talking weeks at a time, we're talking days, but every day is a challenge for us, not only at the QE2, but for the whole province, because we serve the whole province. And all of our other colleagues in the district health authorities have all gone down for the services they've been able to provide in order to take back patients to their areas. So right across this whole province, and in fact the Atlantic provinces, because we serve the Atlantic provinces for many things, patient care has been impacted.
So while it is not a great situation, is it manageable given the window as you understand it?
Well, perhaps you can ask patients if it's manageable. For us, we are trying to provide the safest care we can for the people who are currently here, for people who've waited months and months for their surgery, for people who are worried about the procedures that have been canceled, who've also waited months and months. This is more than an inconvenience to those people.
For every day that there is a strike, how many days will it take to get back on track at the other end of it?
So our surgeons and our physicians and our administrative colleagues will be working to reschedule all these patients. We're calling this postponed because they will all be done. We have very limited capacity in our organizations because of the demand on all of our services. So we can't tell you that. As we do with everything, we triage. We see who the patients are who are most in need, and they will be done the fastest. And we will try as much as we can to get those done in a timely fashion.
So I think you said 30% of nurses didn't attend work today. Can you give us a more exact number?
We don't have the exact number for you. We can get that for you. I don't have it right with me now, and it is a moving target.
And how were the nurses who are coming to work affected in terms of are they being
So we've got a variety of ways that we're doing that. For some nursing staff, they were asked to work some overtime and stay over if there weren't nurses to relieve them in their particular area. In some of our areas, all of our nurses have showed up, so that's terrific. In many of our areas, even though they were being advised by the union not to come, people did come to work. So we have some agency staff that we can call in. We have a lot of different ways that we try to get staffing for our particular areas. And so it would depend on the patient population. It would depend on how many people were in our beds that we needed to care for.
And how are emergency room services affected?
Barb, do you want to speak to emergency today?
Identify yourself and where you work.
Yeah, I'm Barbara Hall. I'm one of the vice presidents here, and the emergency rooms fall under my area of responsibility. And the emergency rooms are functioning pretty well as normal today. All the emergency rooms, Dartmouth General, Cobequid, Halifax Infirmary, are reporting good staffing levels. All the staff have come to work. And as we've rounded around the emergency departments, they've not expressed anything out of the ordinary. The big issue for the emergency departments is if they have somebody that needs to be admitted, and then there's a negotiation with our flow team to see where we could put somebody, because we're trying to keep our census as low as possible and discharge to home as much as possible. But our continuing care allies and colleagues have been stepping up to make sure that there's supports in people's homes if we have to send them home. So we're doing a lot of things to make sure that we can discharge people. But so far the emergency departments are doing quite well, and all the staffing's there.
Almost 90 surgeries were postponed today. What about tomorrow? Have any surgeries been postponed?
The OR committee will be meeting at 5 p.m. this evening to make that determination, and we'll have to see what the lay of the land is, how many people we anticipate will show up for work tomorrow, what's the status of the current legislation, and so on, before we can know what's before us tomorrow.
Just some people have been waiting. We've talked to a few people, like you said, have been waiting months, a year for these surgeries. And one of the patients that I've talked to is a cancer patient. He says it's life-altering surgery, and his surgery's tomorrow. So when do you think he might hear if it is canceled?
He will hear. Most of what we're doing is just-in-time management, so we'll be making those determinations very late today. And administrative assistants are taking home all the patient contact information, and we'll be letting people know through the evening what the status of their surgery is for tomorrow.
And just about bargaining yesterday, both sides were bargaining most of the day. So before the legislation was introduced, did it break before that? Was there an impasse before that, or did the impasse happen after?
The impasse happened before, and then people came back to the table, and there was a decision that we couldn't go any further.
Can you explain why?
Well, I think that the union walked away from the table. We had both had been going back and forth on various issues throughout the day, but couldn't reach any consensus.
Just to confirm, 30% of the nurses at this building or within Capital Health didn't show up today?
Within Capital Health.
Okay. Now, you talked about making arrangements to get patients from other district health authorities back there
Yes.
to meet your workload. What other things are you doing in concert with the health authorities to help ease the situation here?
Well, that's primarily what we're doing with the other districts. They're working together so that often patients who may have come to the QE2 who didn't need specialized care, but were just coming here for their surgeries or for emergency surgeries, those districts are looking at doing those in their own area. But primarily for us, it's getting back to those districts, the patients who would need the specialized services of Capital Health, of the QE2.
And you had said that the quote that I think Jane was referring to, we have many more patients in the QE2 than we can safely care for. So are patients in this building in an unsafe condition?
Well, the patients in this building do not have the staff that they typically would have on a normal day. And so we are doing the best we can with all of the resources we have, and we prioritize, so the patients who most need the care would be the ones who would get that. This is not a sustainable model for us to continue with. And, we believe that we need the nurses who are scheduled to work to care for these patients. If we didn't, we wouldn't have them there. So we are urging all of our nurses to come back to work, to not engage in illegal strike, because this is a very busy time for us. Our doors never close, and we are full at the QE2 site, and so this cannot go on for any length of time. But are our patients unsafe at this current moment? Are our lives in jeopardy? I would say that we're doing all that we can to prevent that from happening.
Have patients been moved from here who aren't from other districts to another district?
The only patients that we would have done that with are our detox patients, because there are no staff to manage that particular unit, so we've moved them out. But for the most part, people who are going back to other districts were from those districts to start with.
Ms. Power, are you in a position to offer nurses who did not report for work today amnesty if they were to return to work tomorrow?
So we'll be taking under advisement in further conversations that we have what the repercussions will be for people who have chosen not to come to work today. And so we're not in a position to say that right now, because we need to have some further discussion. We need to understand how long this will go on. There are lots of factors involved in that.
Can we take one more question? With this legislation affecting other nurses, paramedics, that sort of thing, has there been any kind of, reaction from them, or any kind of resistance from them to any of what you're trying to do to alleviate the pressure you're under?
So we've not heard from other unions other than NSGEU, and we've not been made aware that there's been any kind of job action on that particular front. We do know that some of our staff, our LPNs, who are part of NSGEU but not part of this local, have chosen to participate in this illegal strike. But we have no indication that other unions are doing something similar.
So just to clarify, will all patients who have surgery be contacted, or just the patients whose surgeries will be canceled?
The patients whose surgeries will be canceled. And that's been our consistent message. For anybody we're canceling, we'll be in touch with them to let them know that for any procedures. Thank you very much.